Hi, I'm Dr. Jeff Shad, founder of South County Spine Care. DRX 9000 and DRX 9000C. Two separate systems, same machine. DRX 9000 for lumbar spine, meaning for lower back problems. Candidates that are to use spinal decompression are mainly disc herniation patient, disc degeneration patient, disc prolapse, disc bulge, disc extrusion, disc fragments, attached and detached. We will talk about all these categories in detail. First, disc herniation and disc bulge. Similar. Basically, disc is pushing out and is pinching your nerve. And by decompressing the spine, that means pulling the two vertebrae apart, you're able to create negative pressure within the interdiscal pressure, and it causes a phenomenon called vacuum phenomena. Actually sucks the disc material, the nucleus pulposus, which is the jelly part of the disc, back into the center of the disc. By doing so, it will pull in disc herniation and pulling disc bulge and relieves the nerve. Disc degeneration, on the other hand, it happens in older patient, which means the disc has pretty much degenerated and dehydrated. It requires to be hydrated. Again, by pulling the spine apart, 18 cycles of 1 minute pull and 1 minute rest, you're creating that negative pressure we just talked about, and you're bringing in nutrients and oxygens within the disc. As I mentioned before, or maybe we didn't, disc is not really highly vascular part of our body. That means there's not that many blood vessels going to it. So it receives its nutrients from cerebrospinal fluid that floats in your spinal column. By creating the negative pressure, pulling the vertebrae apart, you're able to pull some of that fluid within and surrounding the disc and helping hydrating the disc and bringing nutrients and oxygen. By the way, during spinal decompression, we do provide oxygen therapy. We oxygenate your system during the decompression so your body is able to heal itself faster and better. Now, disc prolapse and disc extrusion with fragment which is attached or detached. Okay, extrusion is when the disc completely has come out of its surrounding. Disc normally is surrounded by annulus fibrosus. It's a fibrous tissue. It's like a series of rings that hold that nucleus material, which is the jelly, within the circular containment. When that lining tears and the material from the inside of this extrudes and comes out, you could sit right next to the spine without being fragmented, which means it pushed out and sitting outside of the disc, but it still has a pathway which attaches itself to the inner part of the disc. It's easier to treat those patients, again, using spinal decompression as a tool to create the negative pressure to pull the disc material back into place. Some of the disc material normally observe itself by nature. Our body has enzymes that would attack the white blood cells, that would attack they look at the disc material as foreign body, and they would attack it and dissolve it to a certain degree. Depends what age you are and what degree of disc extrusion you have. Then gives you a better prognosis or not so good of a prognosis. So, fragmented attached is a good candidate for spinal decompression. Unfortunately, disc extrusion with fragments that are detached, that means the material has extruded out and have detached itself, has no pathway to go back in, those are surgical candidates. And for those who have free fragments, we do work with spinal surgeons that do microsurgery to remove that fragment from your spine. Stay tuned for the next segment. Thank you very much. you.